My name is Tabi Upton, and I had 2 reconstructive foot surgeries by Dr. Wamack at the McCauley office. And my story begins really as a senior in high school. I was an athlete and I played basketball, and suddenly my feet would start to hurt while I was playing, and it was discovered that I had fallen arches. So at that time I got orthotics, and I wore them for probably about 20 years basically. Since that last year of high school, until 2011, when I decided to go ahead and get foot surgery to correct my flat feet. Over those 20 years, my feet were, the bones in my feet were spreading out, and my ankles were bending inward, and it was getting harder and harder to walk, to exercise, to do anything without my feet starting to hurt. And I was seeing Dr. Wamack already for orthotics because at that time my doctor, Jenny Bradshaw, had referred me to get new orthotics. And he just basically told me that it was not looking good for my feet. In fact, the first time I went in, he wanted to take pictures of my feet because he said I had won the award for having the flattest feet he'd seen that year. And I thought that was kind of funny. But he just explained that eventually I would probably end up in either a foot brace or have orthopedic shoes that I would probably have to wear all the time for the rest of my life because my feet were just worsening and worsening. So I had never had surgery before. I'd never spent the night in the hospital before, and I just put it off. Maybe there's another way, some miracle, my feet will correct themselves. But of course they didn't. And so I did go ahead, and I had my first surgery in 2011. And I was so terrified. I tried to talk about maybe changing the date while I was sitting there with an IV in my arm the day of surgery, and they had to put me under before I even went back to be prepped because I was so anxious. I started crying, and it was just a big ordeal for me. But when I woke up, my mother greeted me and told me that I had a brand new foot. So that began recovery time. And what that meant for me was that I was going to be off my feet completely for 3.5 months. And that, I had no idea what that would be like, so I really didn't. I knew that was going to be very hard, but I really had no idea. That meant basically that I was going to have to take showers with my foot hanging out of the shower, that, I had to get on my bed and kick my feet in the air to get dressed in the morning. Eventually I had to have the other foot done, and I had to drive with my left foot. Don't call the cops on me, but I learned to do that so that I could work. And I had to ask people to help me. I could not even take my garbage out. And I had trouble, obviously, cleaning and doing things like that. But I had a great arsenal of friends and family who came to help me. And my parents stayed with me for 3 weeks. And I had great physical therapists. I had Brandy and the whole team at the Center for Sports Medicine. I am a counselor by trade, and so I was also examining how I was dealing with things emotionally. And I was quite shocked to find that there are not a lot of groups for recovery, so I'm glad we're doing this video so we can kind of give each other group therapy if you're facing a surgery like the one that I had. I will tell you that you really have to take time for yourself during recovery. You need to take time to maybe reflect, to read, to journal. That helped me a whole lot. To pray. That helped me tremendously. And to think positive thoughts about your healing. I was afraid my foot was never going to heal because it took so long for me to be able to walk again. And I just had to remind myself that it was a journey. I got a little anxious towards the end because for me, recovery meant really 2 years. I had my first surgery, as I said, in 2011. It was in February, and then I had my second surgery on the other foot in December of that same year. And I was not supposed to do vigorous exercise until December of 2012, and the Zumba craze was just kicking up, and I was so antsy to get out there that I started doing Zumba. And at first, things were going great, and I was so proud of myself that I could finally exercise. And then my foot started to hurt, and then it had some sharp shooting pains going through it. And so I had to go back to the doctor, get x-rayed. Fortunately, there were no stress fractures, but I had really stressed my foot out. And I had to get back in the boot for several weeks, and I'm still healing from that incident. So please listen to the doctor, whatever doctor you have, and be patient and just know that you're going to get there. I did just purchase a bike, and I'm looking forward to biking because that's a good exercise for someone who's had foot surgery. And I also got goggles and a swim cap yesterday because I'm going to start swimming, and that's also a great exercise for somebody who has had foot surgery. So just take care of yourself in those ways, and if you have setbacks, push through them. Just know that you're going to get to the other side. So just keep yourself looking up and telling yourself that you're proud of yourself. I mean, I have to talk to myself. And I really felt that I deserved a diploma and a cap and gown at the end of my journey, but nobody gave me one, so you might want to give yourself one, even if you just give yourself a round of applause for getting through your recovery. That's my story, and I'm sticking to it.